Some sad news to report. The Oregon Health Authority says an infant has died with COVID-19, the first child under 18 to die from the virus in Oregon.
Umatilla County Public Health says he was diagnosed on January 17th and then died the same day. They say he did have underlying conditions. Fox 12's Drew Marine tells us what we know about this case and what symptoms parents can look for in their own children. What a sad situation, Drew.
Yeah, it's definitely heartbreaking. We don't know how old that infant was, but we do know infants dying from COVID-19 is a rarity. I spoke with a neonatologist at OHSU today who says because they're so rare, there's no need for parents to panic.
Very tragic, and my heart and our hearts go out to the family.
Thursday, the Oregon Health Authority reported an infant boy from Umatilla County has died from COVID-19. He was first diagnosed on January 17th at the Cadlick Regional Medical Center in Richland, Washington, and died the same day.
I believe this is the first death that we've had of a child, of anyone under the age of 18.
In this case, Umatilla Public Health says the infant had underlying conditions. While we don't know the specifics of this infant's conditions, Dr. Bukosi Dube with the OHA says these are some underlying conditions that could make a child's case more severe.
There are congenital heart diseases that can predispose one to have severe illness and death. Lung conditions, cystic fibrosis, diabetes type 1. So there are plenty of conditions that could potentially lead to more severe illness and potentially death.
But neonatologist at OHSU, Dr. Dimitri Duchovny, reiterates this case is a rarity. According to the American Academy of Pediatrics, children, including infants, were 0% to 0.25% of all COVID-19 deaths in the U.S. Because infants can't communicate, Duchovny says to look out for these symptoms in babies.
How are they feeding? Are they feeding regularly? Are they making wet diapers? And that is a great sign of health. Are they able to maintain good nutrition? Are they still breastfeeding as well as they were when they weren't sick?
The OHA says you can also look out for symptoms like trouble breathing, pain or pressure in the chest that doesn't go away, and bluish lips or face.
Governor Kate Brown put out a statement about this death today, saying in part, quote, "We have all worked together for nearly a year in Oregon to protect the lives of those we hold most dear. The loss of a life so young is an indescribable tragedy for a family. Dan and I send our thoughts and condolences to the mother and family of this child, whose grief must be unimaginable in this moment." Live in Aloha, Drew Marine, Fox 12 Oregon.